I've had the opportunity over the last 13 years to work extensively with addicted healthcare professionals, the last 4 as the medical director of the healthcare program here at Bradford Health Services in Warrior, Alabama. The healthcare treatment program at Bradford over the last 4 years has had extraordinary growth. I think that we are very excited about that, and we know that's because of the results. Individuals who refer to our program are sometimes hesitant to send somebody to Warrior, Alabama. However, they find out when they come and visit the facility, we have a very top-notch facility with individuals who have expertise in treating healthcare professionals. The most important part of dealing with an addicted healthcare professional is the evaluation. And this is a very extensive evaluation that we do at Bradford. Over the last 4 years since I've been here, we've done over 1,500 evaluations on addicted healthcare professionals from all over the country. This evaluation includes an initial history and physical, drug screening, a psychiatric evaluation, addiction medicine evaluation, and then extensive psychological and neuropsych testing. We also get collateral data from families and co-workers, then condense all that data and meet with the patient, usually at 4 to 7 days after admission, and go over the findings. If the individual is found to have an addiction disorder, then we make a recommendation with treatment. When you have a healthcare professional that has an addiction issue, there are some challenges that we don't see in the average alcoholic or addict. The drugs of choice are very similar. For physicians, the number 1 cause of addiction is alcohol, as in the general population. We also treat probably more nurses in the country than anybody, and those individuals tend to have a higher incidence of opiate addiction, prescription opiates. And since they go back to work with those substances, it's very important that we make sure when they return to work that they're going to do well. There's a much higher standard for healthcare professionals, and a couple of reasons behind that is because, number 1, they're in a safety-sensitive position, and you want to make sure that when they return to work, that their addiction is not going to affect their ability to practice medicine, dentistry, nursing safely. A center like Bradford that's used to dealing with healthcare professionals works with those individuals that monitor healthcare professionals after they leave treatment and make sure things like therapy, random drug screening, meetings are all set up as they transition to make them more successful, period. We'll also address issues that may be specific for that individual if they're returning to workplaces where substances that they've been addicted to are there. Once the individual completes treatment at Bradford, we do have different levels of care, including outpatient programs if they're in the area, for the individual to continue their treatment program. There have been numbers of studies showing that with good residential treatment like the ones we provide here at Bradford, along with aftercare monitoring provided by state programs, the success rate at 5 years is between 80 to 90%.